Yo, what up? It's a tip of the week, and today we're going to discuss antibiotics. All right, so the first antibiotic that I like to use is going to be chlorhexidine. It's a wonderful drug because what it does is it freshens the breath and it also decreases um, the bacterial load that's in a patient's mouth. So if you see somebody come in and you're about to do a pretty large surgery on them, let them rinse for about 1 to 2 minutes with the chlorhexidine, and you'll be pleased with what you see and what you smell. Another antibiotic that I like to use is amoxicillin. It works really well with most dental infections, and you're also able to use it to prevent any issues such as endocarditis as like a prophylactic, especially if a patient has a recent knee replacement or any artificial heart valves. It generally doesn't have too many contraindications with patients' medications or just health. So just be aware that one main question that you should ask is if they have had allergies to it in the past. There is another common antibiotic that you've heard before, and it's generally used for the sinus. There have been one time, I should say, that there's been a wisdom tooth that's jumped into the sinus on me, and when I went to go retrieve it, I went ahead and I gave them Augmentin. Augmentin is really good because what it does is it helps with bacteria that are resistant to our antibiotics. And when I give that medication, it generally does very well. Now, when you use these medications, you really, really, really want to make sure that you are taking good history on the patient to make sure that there aren't any allergies or contraindications when using any type of antibiotic. So just keep that in mind. And another thing is this: anytime you're prescribing antibiotics, please be aware that antibiotics are great, but they can cause resistance. So as you are treating your patients, please be aware of that because you don't want to give something that's going to work out, but later down the line, that's going to have some significant effects. I hope today that you smile after surgery. Make it a good one.